In this video, we will be discussing about the facial nerve. We will discuss about the anatomy, course and branches of the facial nerve. First, we will discuss about the anatomy of the facial nerve. So, we look at the nuclei of the facial nerves. If this is the pons and this is the medulla. So, the facial nerve nuclei is located in the lower part of the pons. So, it consists of three nuclei. First one is the motor nuclei. So, the motor nuclei is located in the lower part of pons. This is the motor nuclei of the facial nerve. So, motor nucleus. So, from the motor nucleus, we know that the motor root arises. And these fibers, the motor fibers, are innervating some group of muscles which are derived from the pharyngeal arch. Pharyngeal arch muscles are, second pharyngeal arch. Second pharyngeal arch muscles are innervated by the motor root of the facial nerve. So, facial nerve is known as the nerve of second pharyngeal arch. So, the motor root of the facial nerve innervates the muscles derived from the second pharyngeal arch. Which are the muscles? So, this includes the stylohyoid, posterior belly of digastric, and the muscles of facial expression. Muscles of facial expression and the motor root also supplies a muscle which is located in the middle ear, that is the stapedius muscle. So the stapedius muscle is also supplied by the motor fibers of the facial nerve. So the motor fibers of the facial nerve which are arising by motor root from the motor nucleus of the facial nerve, it supplies a stapedius muscle in the middle ear. It supplies the muscles derived from the second pharyngeal arch or second arch muscles, which includes the stylohyoid, posterior belly of digastric, and muscles of facial expression except the levator palpebrae superioris. So that is about the motor root. Next, the facial nerve also carries along with it some parasympathetic fibers. So the nuclei of these parasympathetic fibers is located near the motor nucleus in the lower part of the bones. So this nuclei which gives out parasympathetic fibers, this nuclei is known as superior salivatory nucleus. Superior salivatory nucleus. And from the superior salivatory nucleus, some preganglionic parasympathetic fibers arises, and it supplies two group of glands. First one, it relays in the pterygopalatine ganglion, and it supplies secrete of parasympathetic fibers to the lacrimal gland, that is lacrimal, nasal and palatine glands. So the preganglionic parasympathetic fibers arising from the superior salivatory nucleus release in the pterygopalatine ganglion. From this ganglion, postganglionic parasympathetic fibers supplies the lacrimal, nasal and palatine gland. And the parasympathetic fibers arising from the superior salivatory nucleus also release in another ganglion which is known as submandibular ganglion, and the postganglionic parasympathetic fibers then supplies which organ? Submandibular and sublingual salivary gland. Submandibular and sublingual salivary glands. So know that the facial nerve has a parasympathetic component along with it. So the parasympathetic fibers are given off to the lacrimal, nasal, palatine glands and submandibular, sublingual salivary glands. So these parasympathetic fibers are carried through two branches of the facial nerve. So we will discuss about it later. And next nucleus, which is located in the lower part, is known as nucleus tractus solitarius. Nucleus tractus solitarius. Actually, this is a sensory nucleus. This is a sensory nucleus, which is a sensory nucleus. The sensations from the anterior two-third of the tongue, if this is the tongue, the sensations from the anterior two-third of the tongue is carried by these fibers into the nucleus known as the nucleus tractus solitarius. So it receives taste sensations from the anterior two-third of tongue. Sensations from anterior two-third of tongue are carried out by these fibers, and it relies in the nucleus known as the nucleus tractus solitarius. So the motor nerves which supplies the muscles derived from the second pharyngeal arch are known as which fibers? Special visceral efferent fibers. And the parasympathetic fibers are known as general visceral efferent fibers. And the sensory fibers are also known as sensory fibers, which receives taste sensations from anterior two-third of tongue are known as special visceral efferent fibers. And the facial nerve also carries along with it some sensations, general somatic efferent sensations from the ear. And this relates in the spinal nucleus of the trigeminal nerve. So this is clinically irrelevant, so it is not discussed here. So the components of the facial nerve, the functional components of the facial nerve are special visceral efferent fibers, which supplies muscles of pharyngeal arch, second pharyngeal arch, general visceral efferent fibers to the lacrimal, nasal, palatine, submandibular, sublingual, salivary glands, special visceral efferent fibers which carries the taste sensation from anterior two-third of the tongue, and general somatic efferent which carries the sensations from the external ear. These are the functional components of the facial nerve. Now we'll discuss about the force of facial nerve. First of all, draw the pons, medulla, this is a middle cranial fossa. This is the medullary cavity. So this is the posterior wall, this is the anterior wall, this is the medial wall of the medulla. So this is the pons and this is the medulla. So we look at how the motor fibers pass here. So the motor nucleus is located in the lower part of the pons. From here the motor root arises. Then it enters the petrous part of the temporal bone. First of all, from the motor nucleus, the motor fibers arises like this. It first passes like this and it takes a turn here around the abducens nucleus. Then it passes laterally. So, and it leaves the CP ankle and it enters the petrous part of the temporal bone. So in the petrous part of the temporal bone, there is internal acoustic meatus. So the facial nerve enters the internal acoustic meatus in the petrous part of the temporal bone. So inside the internal acoustic meatus, it is accompanied along with the vestibular cochlear nerve and also the labyrinthine vessels. Then it passes through the internal auditory canal. It passes through the internal auditory canal. And on reaching the medial wall, this is the medial wall of the middle ear, it takes a sharp posterior turn. It takes a sharp posterior turn. So it takes this turn behind a process in the medial wall that is known as the processus cochleariformis. Processus cochleariformis, which is located in the medial wall of middle ear. So in the medial wall of middle ear, it passes between the two structures, that is the lateral semicircular canal above and the pyramidal eminence below. So just distal to the pyramidal eminence, it descends downwards on the posterior wall of the middle ear. And it exits out through a foramen, which is known as, this is the mastoid as a styloid process, and it exits out through the foramen, which is known as a stylomastoid foramen. So this foramen is known as the stylomastoid foramen. So after exiting out through the stylomastoid foramen, immediately it gives out a branch which is known as posterior auricular branch. Posterior auricular branch. Then it passes through the substance of the parotid. This is a parotid gland. Then divides into some branches. So imagine this to be the face. This branch is known as temporal. This is known as zygomatic, buccal, marginal mandibular, next one cervical. So these are the terminal branches of the facial nerve which supplies the muscles of facial expression. So after leaving the stylomastoid foramen, it gives out a posterior auricular branch and some branches to muscles like stylohyoid and posterior belly of digastric also. Stylohyoid and posterior belly of digastric. So that's all about the course of motor root of the facial nerve. So the motor root arises from the motor nucleus. It then turns backwards and encircles the abducens nucleus and forms the facial follicles. Then it passes laterally. It takes a turn around the abducens nucleus and forms a facial follicles. Then it passes laterally and it leaves the cerebellopontine angle and enters the internal auditory canal through the internal acoustic meatus. So after passing through the internal auditory canal and reaching the medial wall of the middle ear, it takes a sharp posterior turn which is known as the genu of the facial nerve. So this is the first genu of the facial nerve. Then passing through the medial wall of the mid-layer between the lateral semicircular canal and the pyramidal eminence, just distal to the pyramidal eminence, it then descends downwards in the posterior wall of the mid-layer. So this second turn is known as the second genu of the facial nerve. So this is the second genu of the facial nerve. So then it passes downwards through the posterior wall and exits out through the stylomastoid foramen. Immediately after leaving the stylomastoid foramen, it gives out a posterior auricular branch and muscular branches to the stylohyoid, posterior belly of digastric, and some terminal branches after passing through the substance of the parotid. So in the second genu, it gives out a branch to the stapedius also, to the stapedius muscle. So that is the stapedial branch, stapedius muscle. So this is the cause of the motor root of the facial nerve and the branches which are arising from the motor root of the facial nerve. So now what happens with the parasympathetic fibers? The parasympathetic fibers arises from the superior salivatory nucleus. It also passes along with the brachiomotor fibers of the facial nerve proper. So these motor nerves are also known as special visceral efferent fibers. These are also known as the facial nerve proper or brachiomotor fibers. So this parasympathetic fibers arising from the superior salivatory nucleus, it passes along with this motor nerve, and so we know that the parasympathetic fibers are destined to supply two groups of gland. One is the lacrimal gland. So the parasympathetic fibers supplying the lacrimal gland, it gives out a branch near the genu of the first genu, which is known as the greater superficial petrosal nerve. So this is the greater superficial petrosal nerve, and it enters the middle cranial fossa and passes through a foramen which is known as the foramen lacerum. This is the foramen lacerum, and where it is joined by another nerve which is known as the deep petrosal nerve, which carries the postganglionic sympathetic fibers from the internal carotid artery. So the greater superficial petrosal nerve passing through the foramen lacerum, and it is joined by the deep petrosal nerve. They together form the nerve of pterygoid canal. This is known as the nerve of pterygoid canal or Vidian nerve. So the Vidian nerve, then it reaches the pterygopalatine fossae and it relays in a ganglion which is known as the pterygopalatine ganglion. So the pterygopalatine ganglion, from this pterygopalatine ganglion, postganglionic parasympathetic fibers arises. So, and this has to reach the lacrimal gland. So the postganglionic parasympathetic fibers then passes into the zygomatic branch of the maxillary division of the trigeminal nerve. So it passes with the zygomatic branch. The zygomatic branch again communicates with the lacrimal branch, and in this way it reaches the lacrimal gland. So the parasympathetic fibers to the lacrimal gland is carried by the greater superficial petrosal nerve. It is joined by the deep petrosal nerve to form the nerve of the pterygoid canal or Vidian nerve. The Vidian nerve relays in the pterygopalatine ganglion, and postganglionic parasympathetic fibers then reaches the lacrimal gland. So then parasympathetic fibers from the superior salivatory nucleus has to reach the submandibular and sublingual salivary gland. So another part of this passes down with the motor nerves, and in the vertical segment it gives out a branch which is known as the Chorda Tympani. The Chorda Tympani, it passes through the posterior canaliculi and it enters the midlayer cavity, enters the anterior wall, and through the petrotympanic fissure it leaves the midlayer and it enters the infratemporal fossa. Then it is joined by another nerve which is known as the lingual nerve. But the chorda tympani, it relies in the submandibular ganglion and it supplies the sublingual and submandibular glands. So the chorda tympani exits out through the petrotympanic fissure. It joins with the lingual nerve. The chorda tympani, it relates in the submandibular gland, and the postganglionic parasympathetic fibers from the submandibular gland supplies the submandibular and sublingual salivary glands. So that is all about the parasympathetic division. So the parasympathetic fibers are carried by the two branches, that is greater superficial petrosal and the chorda tympani. So this is the chorda tympani. Now and another part is the sensory part. The sensory nucleus is located here, which is known as the nucleus tractus solitaris. So we know that this is the tongue. The sensations on the anterior two-thirds of the tongue are carried out by the lingual nerve. So the lingual nerve carries the sensations on the anterior two-thirds of the tongue. We know that the chorda tympani joins the lingual nerve. So the taste sensations on the anterior two-thirds of the tongue are carried out by the chorda tympani, which passes like this and it reaches the nucleus tractus solitaris. It reaches the nucleus tractus solitaris. So that's all about the sensations. Now we look at the parts of facial nerve. Through the course of facial nerve, we have seen that it consists of a intracranial part. So the intracranial part, it starts from the motor nuclei till the internal acoustic meatus. So that length is approximately 15 to 20 millimeter. Next it enters the internal acoustic meatus. That part is known as meatal part or intrameatal part. The length is 8 to 10 millimeter. And third one is after passing through the meatus, it enters the labyrinthine segment. So after passing through the meatus, it enters the bony canal. That bony canal is known as the fallopian canal, which is inside the petrous part of the temporal bone. Fallopian canal. That part is known as the intratemporal part. Intratemporal part, which is inside the petrous part of the temporal bone. So the intratemporal part is further divided into labyrinthine part. So the labyrinthine part extends from the internal acoustic meatus to first genu of the facial nerve. So it extends from the internal acoustic meatus to the first genu. And it is approximately 4 to 5 millimeter. And it is the shortest and narrowest segment of the facial nerve. And the facial nerve is more prone to compression at this point. That is, any inflammation of the CNS of the facial nerve can result in facial nerve injury at this point. So, and fourth one is another part which starts from the first genu of the facial nerve and till the pyramidal eminence, that is known as tympanic or horizontal segment. Tympanic part or horizontal segment, that is located in the medial wall of the middle ear. Tympanic or horizontal segment. So the another bony landmark here, that is the genu of the facial nerve, is located just behind. The first genu is located just behind a bony process known as processus cochleariformis. So this processus cochleariformis is an important landmark for the facial nerve during surgery. And the facial nerve is more prone to injury during surgery at this point, that is in the tympanic or horizontal segment. Maximum bony dehiscence occur in this part, so more susceptible to injury during surgery at this part. So more susceptible to compression at the labyrinthine part. The length of tympanic or horizontal segment is 8 to 12 millimeter. So it is extending from the first genu to pyramidal eminence. And another part is from the second genu of the facial nerve, from the pyramidal eminence to the stylomastoid foramen, that is known as vertical or mastoid or descending segment. So from the second genu to stylomastoid foramen. So that is a vertical. Then the length of this vertical segment is 9 to 16 millimeter. It is the longest part of intratemporal course of facial nerve. And next part is the extratemporal, that is out of the stylomastoid, that is extratemporal. So now, which are the branches of this facial nerve? The branches are so we have seen that so this is the first genu of the facial nerve. So from the first genu, there is a branch which is known as uh, greater superficial petrosal, which is carrying the parasympathetic fibers to the lacrimal nasal palatine gland. Greater superficial petrosal, that's the branch petrosal that is parasympathetic. And another branch which is located from the second genu is the motor fiber, motor branch, purely motor branch to the stapedius muscle. And just below the stapedius muscle, there is another branch which is known as the Chorda Tympani. This is Chorda Tympani branch, which is carrying taste sensations from the anterior two-third of the tongue and also carries parasympathetic fibers to the submandibular and sublingual salivary gland. And branch which is located just below the stylomastoid, that is called the posterior auricular branch. Posterior auricular branch, and branches to some muscles like posterior belly of digastric and stylohyoid, and terminal branches like temporal, zygomatic, buccal, marginal mandibular and cervical to the muscles of facial expression. So the greater superficial petrosal is carrying parasympathetic fibers to the lacrimal nasal palatal glands. Chorda Tympani, taste sensation from anterior two-thirds of tongue. And it also carries parasympathetic fibers to the submandibular and sublingual salivary gland. So the branches are greater superficial petrosal from the first genu, from the second genu stapedius, which is a motor branch, and chorda tympani, which carries parasympathetic as well as sensory fibers. And the motor branches are posterior auricular to the posterior biliary digastric, styloid, and muscles of facial expression. That is all about the facial now. Thank you for watching this video. To see more videos on my channel, please subscribe to the channel. Thank you.